Welcome to Healthtech with Purpose podcast. Today we host Liana M, CEO of FOLX Health. With a rich background in leadership and innovation, Liana is reshaping healthcare for LGBTQIA community, making it more accessible and affirming. Liana's philanthropic endeavors have earned her recognition on the New York Observer's Top 20 Philanthropists Under 40 list. Join us as we delve into Liana's inspiring journey, her vision for FOLX Health, and the profound impact of her work on health accessibility and inclusivity. Liana, welcome to the podcast. How are you today?
I'm good. Thanks for having me.
Yeah, it is our pleasure because the work you're doing really brings a new tangent of healthcare attention that is required, and that has always been something where work has to be done, and so much more can be done. So we are equally excited as well about this episode.
Thank you.
So tell us more about FOLX Health and your vision at FOLX Health.
Yeah, so we are really the first digital healthcare platform focused on the LGBTQIA community. I think for us, when you look at our community, we are a large and growing community. So 1 in 10 adults in the US identifies as a member of the community. That number doubles when you look at Gen Z. And so it is, as I said, large and growing. We represent tremendously sophisticated purchasing power. So, if our community were a country, we'd be the 4th largest economy in the world. And yet we live within an incumbent healthcare system that was at best not built for us. And more often than not, openly discriminatory or violent. And it's not just about getting affirming healthcare, which of course is deeply important, but it's actually also about ensuring that people have competent healthcare, queer competent healthcare, right? So it's not just affirming, but actually looking for expertise in our specific needs. And so that's what FOLX seeks to solve for. 78% of our members did not have access to an affirming provider before FOLX. 71% actively avoided seeking healthcare for fear of discrimination. And in FOLX, what they find is an incredibly inclusive, competent healthcare system that is frankly joyful, right? We really believe in healthcare over sick care. And so we take a very holistic approach to healthcare. We have a community platform where people are able to connect with one another and their providers. You're able to connect asynchronously in real time. And then, within a couple of days, meet with providers via, video conference calls. And so really bringing a best-in-class healthcare experience to our community.
Mm-hmm. That's great. So, let's go deeper a bit, from this introduction. So, you mentioned about the challenges that LGBTQIA community faces. We all know on the surface, for example, the discrimination that one may face, or fear of any kind of lack of attention that they may get, and so on. So, can you go deeper, since your work is around the whole ecosystem? So, what kind of deeper challenges that the community faces, and again, how does a solution like FOLX can really help here?
Yeah. So I think it starts with sort of the idea of affirming care, right? I think about my experience. I'm an incredibly privileged person who, nonetheless, whenever I walk into a medical environment, the assumption is that I am in a straight, cis, heterosexual relationship, right? And so it leads to uncomfortable moments, like having to have conversations around whether or not I'm on birth control and whether or not I have a fear of being pregnant, and needing to explain sort of, it's hard, I think, anytime you walk into a situation and the assumption is that who you are is not the norm, right? Because then it puts you in a position where you're having to explain yourself in a way that, frankly, I shouldn't have to. And so I think for us, it starts with making no assumptions and really thinking about healthcare as a partnership between clinicians and the patients. We call them members. And so really coming in with, look, we know the clinical side, you, and the magic happens when we can bring those two things together. And so I think for me, that's that's sort of the affirming side of it. And it's, the intake form, having a multitude of pronouns and different ways to identify yourself, asking questions that are not sort of inherently judgmental around sexual practices, that don't make assumptions around sexual practices. And so I think that's the first part of it. The second part of it is that expertise, right? So the average clinician graduates from their medical training with 5 hours of LGBTQIA specific training. And that's just frankly not enough, right? So we are more likely to suffer from substance abuse, mental health issues. It is every day we wake up to a new onslaught of laws that are directed at controlling our bodies and our lives. And that's stressful. And we know that stress leads to worse health outcomes. And so, our clinicians are people who have spent their careers really building an understanding and an expertise in the specific challenges of this community. And so there are people who are writing, WPATH guidelines and, working closely with various, health and legal bodies to help inform how we think about care for this community. And so when there are challenges that either arise, like MPOX as an example, or when you think about things like how we build our families, which is an incredibly joyful experience, but the intersection of that and, if you're on hormones or, if you're not cis. And so really bringing that expertise, that comes from just working with this community all day, every day.
Mm-hmm. Right. So, since another thing that you mentioned, Liana, was about the size of this market, and and I could pick that up, like, if the size was to be compared, it could be like the fourth largest economy. So, why do you think that this whole market has been ignored till now? Again, what are those like deep-rooted challenges that have allowed that this development has not happened till now?
Yeah. Well, look, I think the reality is, in some cases, it is that even a very well-intentioned practitioner, has a multitude of patients. And though 1 in 10 is still a significant percentage of their potential population, it is still, they have 9 other patients who don't fall into this community, right? And so some of it is just, providers are overworked. And so taking the time to research and understand the specific challenges of 10% of their community can be challenging. They have the other 90% that they're thinking about. Whereas for us, because it is a singular source of focus, we're able to really invest the time and the energy and the effort in building a more nuanced understanding. Some of it is just the inherent discrimination of the healthcare system, right? And that's not just against our community. We know that when people talk about health studies, like what they're talking about is those studies based on, typically white middle-aged men, cis men. And so, for us, a lot of it is looking into the literature and then pivoting that understanding into how it impacts our community, because there aren't sort of large scale studies being done on our community. And so really parsing through with our medical knowledge, what are the things that apply to our community? What are the things that are maybe different? And then how do we actually validate in really, medically sound ways, whether or not that is accurate. And so, so I think, I guess, to answer your question, I think it's twofold. I think one is even a very well-intentioned practitioner just may not have the bandwidth to become an expert in this space. And then I think there are, some just deeply discriminatory forces at play. And those are, true for not just the LGBTQI community, but I think because we are so marginalized, it is maybe more true for us than other communities. And so, you look at people who, are not doctors who are making decisions about our bodies. And ultimately that is an uphill battle that we have to fight.
Okay. Yeah. I can sense that, of course, as an outsider. So tell us more, Liana, like what kind of training, or onboarding process that happens, when, let's say you have practitioners that want to become part of FOLX, and how do you, help them transition towards becoming an actor into the ecosystem?
Yeah. So we've been really fortunate. When we were founded, one of the first things we did was, instead of training people up, we actually went out into the market and identified the best practitioners and brought them into our practice. And for them, this was a huge opportunity, because for a lot of people who care deeply about this community, what would happen is they would graduate from their medical training, and then they would go to really important institutions like Fenway or Callan Lord, and they would get their training sort of in an apprenticeship model. But you're limited to where you can live if you have to work at a clinic that is, there aren't that many clinics that are that expert in this community. And so for them, it was an opportunity to be able to practice from home, to be able to practice amongst other practitioners who have made this their life's work, to be able to provide care to a broader swath of people. So much of care is often dictated by your geography. And so to be able to bring this level of care to people that would otherwise not have access to this care, I think was something that was deeply motivating to our community of clinicians. And so, so we were able to bring in really the best of the best.
This episode of Healthtech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health, where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Healthtech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
And then from there, we're able to build, we worked with them to build different training modules and best practices that allow us now to bring in people who maybe aren't quite as experienced, but have demonstrated a deep passion for this community. And we're able to leverage sort of our initial swath of practitioners' experience to help train the next generation of practitioners. So, whether that's pairing them with a mentor who's been doing this work for many years, whether that's leaning into our training modules, whether that's, weekly or bi-weekly sessions with all of our clinicians where we discuss, cases that are maybe not as obvious, and we're able to really dig into those and build consensus around what the best treatment path is or the best approach is. And so so I think it's a really multifaceted always on training model.
Makes sense. So tell us more about how the whole company is kind of structured, or what all solutions are currently available, what all let's say are in the pipeline, for example, so if you could shed more light on those.
Yeah. So about a third of our.
Yeah. One last thing that I'd like to mention is that I saw that one important aspect of your solution is the community, where I think people can connect with each other too. So maybe you want to elaborate on that one.
Absolutely. So as I said earlier, we really focus on healthcare holistically. So I think a lot of times when you think of healthcare, what you're actually talking about is sick care. So I am sick, how do I get better? And our perspective is that healthcare really needs to be holistic and something that we're always investing in. And so we really take a multifaceted approach. So about a third of our team is clinicians. So unlike other solutions that, sort of operate tangentially within our community, which are more like referral networks, we actually employ clinicians who are out providing care. And essentially, you come onto our platform, you sign up for a membership. You can either sign up on a month-by-month basis or for a less expensive annual membership. That membership gives you access to making appointments with our clinical care team, but also gives you access to two really important parts of our platform. One is our referral network. So, not all care can be provided via digital telehealth. And so where we are not able to provide the care, we can get you to someone who we know is at minimum been vetted for providing affirming care. And we tier our referral. So we can say to you, look, we can get you to somebody that, has expressed a willingness to care for this community, all the way up to, platinum tier, which is this person has really dedicated their career to our community. And you can choose, maybe the person who's not quite as, as focused on our community is closer or has shorter wait times, and you're willing in this instance to, make that trade-off. Or maybe not. Maybe actually it's really deeply important to you that for whatever the need, you want someone who's doing this day in and day out. And so you can make that choice. So that's one big element of it is that referral network. And then the other really big element is the community platform. So I think about other digital healthcare providers who I think are doing really important work, but as a former patient of theirs, do not want to connect with other patients of theirs. There's no sort of need for that. That's not the case for our community. And I think a lot about when I was pregnant. I lived in Brooklyn, New York. I had a lot of friends who were having babies, but they were all straight. And I had a lot of queer friends who were nowhere near thinking about starting a family. And so it was, despite living in, one of the most sort of queer cities in the world, a very lonely experience, because it was, I was sort of charting my own path. And I would have so welcomed the opportunity to connect with other people who were in exactly the same position as I was, or maybe even a little bit ahead of me, so that I could learn from them. And so, that is what our content and community platform offers. And it's really varied. I mean, we've had guided meditations over the holidays, as an example. Holidays can be really stressful for our community. And so bringing people together for moments of peace or support. We had a vision setting session at the beginning of the year. But also, we have shop parties. So if you're taking testosterone, being able to get online with other folks who are doing the same, like giving yourself a needle is often intimidating and scary. And so being able to do that within a community of people who can encourage you and are doing the exact same thing, I think can be really helpful. Peer support groups, we post content that people can comment on and connect over. So that's the community platform. And then on the clinical side, the way that I think about it is episodic and continuous care. So episodic is, I've got a sore throat, I've got a stuffy nose, I have these headaches that won't go away. I want to talk to a practitioner who can help me navigate that. And that's sort of the one-off, I just want to talk to my doctor. And then there's the continuous care. So for us, that is primary care, gender affirming hormone therapy, medication management for depression and anxiety, mental health support more broadly. So, the sorts of long-term relationships that you want to build with a healthcare professional that can be really multifaceted.
Great. So that's a lot of things that already FOLX is doing. What are the next frontiers that FOLX wants to bring, to make life even further easy for the community?
I think for us, it's continuing to invest in the products that we have. So really helping to continue to build out the primary care and mental health offerings. They're newer for us. So we launched those at the end of last year. And, so being able to really continue to build those out. I think as we think about sort of the next year or so, I think family planning is a big area of focus for our community. And so that's something that we want to be able to support them through. And then a lot of it is just about driving access. So, we announced late last year that we now accept insurance. And so we're in network with Cigna and Blue Cross Blue Shield of California and Texas and a number of other regional plans. We have not yet announced it, so I can't share the name, but we have another really big national player that we are officially in network with. And so, a lot of our focus is really how do we make sure that people can access this care in affordable ways. And a lot of that for us is partnering with payers and employers to provide this care while continuing to still have our D2C consumer business.
Right. No, I think that would have been a total game changer, because of course you make it then more affordable, more accessible, and people can basically, like, everybody can kind of use more of those services. So that's fantastic, actually. So that's great. So last question, Liana, because this podcast is Health Tech with Purpose, so we would like to learn about your purpose. So, what has been your purpose? What's Liana's purpose, and how did you come to that purpose? So any anecdotes, stories, or any personal reflection that made you drive this purpose?
Yeah, I always, people will often ask me about taking this job. I'm not the founder at FOLX, so I was brought on as CEO about 2 years ago. And I am not someone who wanted to be a CEO, and I think it feeds into my purpose. I have 2 little kids. They're 5 and 8, and I'm just really crystal clear that they are my North Star. So when I think about, what will I hope to accomplish when I take my final breaths, for me, it's, did I raise good humans, and do I have a good relationship with them? And, I think inherent in that is living a life of purpose, right? Because our children are not just listening to us, they're watching us. And so, for me, this job was an example of being able to deliver on that passion and that mission, which is I want them to see me in a career that I find fulfilling. I want them to see me have the opportunity to dedicate my time to something that I believe is making people's lives better. I want them to see me feel fulfillment from that. I think it'll help inform what they choose to do with their lives. And so for me, and it permeates everything we do. We have a gratitude practice as a family. So every day we talk about a kind thing we did or an appreciation that we have, right? So for me, it's about how can I live my life in service of others, so that, I don't have regrets about the way that I spent my limited days on earth. And so I would say first and foremost on that list is my children. I want them to know that they are deeply loved, and I want them to see by the example that I set that, we can make a difference in the world. But more broadly, I've been grateful that I've been able to consistently choose jobs that I feel like are making the world a better place. And when I felt like that was no longer the case or my values no longer aligned, I've left, made difficult decisions in that regard. So I would say that really is my purpose. It's, that human connection and the idea of living in service of others.
Well, that's a great purpose. I think that will definitely make a difference to the world. Thank you, Liana, for joining us today. It was really a great talk that I spent in the last 30 or so minutes. Yeah, thank you. Have a good one.
Thank you. It's been a pleasure. I really appreciate it, Ayush.
Thank you for joining us on the HealthTech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.